Hi, this is Dr. Adam Morse from the Orthopaedic Institute. Today for live, we're doing a video discussion of elbow pain. We've had a lot of patients come in the office this week talking about pain over the lateral or the outside of the elbow over here. We've noticed there's been a bunch of people coming in saying, I noticed that after doing excessive vacuuming, work around the house, squeezing, mowing, or any lifting palm down, when they pick things up, either a heavy purse, a suitcase that they're putting in an overhead compartment, pulling a lot of weeds, or doing a lot of weight training, they're getting pain that specifically is over the outside of the elbow. And just to give you a little demonstration, I'll show you here on my elbow. The pain typically starts right on the outer edge of the bone here, and it tends to radiate down the forearm. They'll start talking about pain when you resist. In other words, I'm pulling my wrist back, but I'm pushing down with my hand against my wrist, and I'm forcing this muscle to fire. They'll start getting a sharp pain over here. They'll notice it when they go to shake hands, when they squeeze things really heavy, opening a jar, or any lifting palm down. What this is called tennis elbow, or epicondylitis, inflammation of where the tendon attaches to the outside of the elbow, and it's usually with the palm down, grasping, or any forceful squeezing or carrying. Once this happens, you'll notice that picking anything up, even a cup of coffee or a gallon of milk, will cause pain. Shaking hands repeatedly, if you have a job where you shake hands, will cause a significant amount of discomfort. And that's what the diagnosis is tennis elbow. You can come into the office. We can see this if it's not getting better, but a lot of the initial treatment you can do on your own and try that before you come in. First thing that seems to work really well is icing that area down. Icing for about 20 to 30 minutes right over that sore spot, and doing some gentle stretches where you pull the wrist down and keep the elbow straight will help to elongate and stretch those muscles out. Gentle massage over those muscles will also help to calm the pain down and will help calm the symptoms down. In addition to the icing, anti-inflammatories, if you're not allergic and you normally take Advil, leave ibuprofen for a headache or sore muscles, you can use these. If you're on blood thinners, you need to stay away from these. And if you have any history of allergies to anti-inflammatories or aspirin, you should not be taking these over the counter. But if you don't, then these medicines will help decrease that inflammation and soreness in the elbow. If you do this, there's some general things to remember. Stay away from exacerbating activities. So no lift palm up whenever you can, as opposed to lifting palm toward the floor. Remember to always pick things up with your hands facing the ceiling. That will use a different group of muscles and decrease the likelihood of flaring this up or dragging on your symptoms. So icing, anti-inflammatories, avoiding aggravating activities, lifting palm up, and gentle stretching exercises like we talked about. Once the symptoms resolve, there are some exercises that you can do to help strengthen the muscles, and the most common of which are what we call wrist extensions. So basically you would take a small weight, can be a 12-ounce can of soda or a can of beans that you have in your pantry, and you would basically grab a hold of the weight or the object and let your wrist hang down this way, and then just slowly bring it up as far as you can and then bring it back down. You don't want to start off with a really heavy weight because this can flare up the tendon. So you're just going to start off doing a couple of sets of 10 repetitions of this type of activity, and that'll allow you to help to strengthen that muscle back up so that when you do go back to activities, it doesn't seem to flare it up again. Other treatment options for this include corticosteroid injections, a strong anti-inflammatory that goes directly underneath the extensor tendons that cause the inflammatories. These can be done in the doctor's office. There are a couple other surgical and non-surgical treatments that are available if this doesn't work. However, we like to stay away from those as much as possible. So before you come in to see us in the office, if you can try some of these things, then that'll give you your opportunity to hopefully avoid coming in and seeing us. And if not, we're always here and available to take care of you. Once again, I'm Dr. Adam Morse. Thank you very much for tuning in, and we hope to see you at the Orthopaedic Institute if you have any issues. Bye.